To understand industrial administration, we must look at where the work happens. Coal mining is one of the most physically hazardous sectors in our economy. The individuals who spend decades extracting resources in these conditions are human beings owed a debt of care. Securing their post-retirement safety is a strict moral obligation for both the state and the employer. This brings us to the core constraint of our case study. Ramesh Yadav, a regional welfare officer, has exactly 10 days to allocate a strictly capped post-retirement pension fund. He faces two competing demands. First, 5,000 retired workers have been surviving on partial pension payouts for the last 2 years and are facing immediate economic hardship. Second, a smaller group of 800 retired workers requires immediate, life-saving medical intervention. This slide shows what those 800 workers face: healthy lung tissue compared against tissue destroyed by black lung disease. For patients like Chandu Lal, time is up. Without immediate healthcare funds, they will suffocate and die. Ramesh is caught in a structural administrative bottleneck. The financial security of a massive majority is in direct, immediate competition with the biological survival of a few. Senior management has already weighed in. They are explicitly instructing Ramesh to prioritize the 5,000 pensioners. This instruction is driven by a phenomenon known in administrative ethics as visibility bias. Large organizations tend to favor actions that are politically safe, highly visible, and affect large numbers of people, completely bypassing complex emergencies that are hidden from public view. Clearing a financial backlog for 5,000 families instantly registers as a major public relations victory and satisfies standard corporate performance metrics. But Chandu Lal's urgent need for oxygen does not register on a spreadsheet. His crisis is quiet and isolated, making it easy for a bureaucracy to ignore. An effective administrator navigating this intense kind of pressure cannot accept the problem exactly as it is presented. You must reject the false binary of choosing to fund exclusively Group A or exclusively Group B. Resolving this ethical crisis requires building a structured legal and mathematical triage matrix, rather than yielding to institutional pressure and simply counting heads. Let's test the data against philosophical frameworks using this decision matrix. The default is Bentham's utilitarianism, which calculates utility by multiplying people by expected benefit. Applying this math, we weigh 5,000 units of happiness for pensioners against 800 units for the patients. Pure quantitative utilitarianism mathematically dictates that all available resources must flow to the pensioners. It is easy to see why senior officials rely on this logic. It offers a clean, mathematically defensible answer that appears highly democratic on paper. However, utilitarianism treats all human suffering as a flat, identical unit. That logic fails when we attempt to weigh financial inconvenience against active biological death. To correct the mathematical model, we must turn to the philosopher John Stuart Mill. He recognized the fundamental flaw in pure numerical calculation. Mill argued for a qualitative difference in suffering. Some forms of pain are inherently worse than others, regardless of the volume of people experiencing them. Severe economic inconvenience for 5,000 people cannot be ethically equated on a one-to-one scale with the suffocation and death of 800 people. We apply a severity multiplier to our data. Modern bioethics reinforces this with a concept called the rule of rescue. This rule observes that society has an inherent moral inclination to prioritize immediate, identified lives in active peril over broad statistical benefits distributed across a population. A direct threat to life carries enough ethical weight to override the sheer numerical advantage of the 5,000 pensioners. A rigorous framework demands administrators evaluate the severity of a threat, rather defaulting to the volume of complaints. For a civil servant in India, philosophical theory must ultimately anchor into hard legal authority. That authority is the Constitution. We have to filter our matrix through Article 21, the right to life. The Supreme Court explicitly interprets Article 21 to include the right to health and dignified life. During an active medical emergency, this constitutional mandate supersedes general livelihood security. Armed with this combined legal and ethical loadout, Ramesh must reject Option 1, which ignores the dying, and Option 2, which ignores the vast majority. He executes Option 3, priority-based triage. A slice of the fund is immediately ring-fenced as an emergency health corpus for the 800 patients. The remaining capital is deployed to reinstate partial pension payouts. sustaining baseline stability and preventing financial collapse for the 5,000 workers. True administrative problem-solving requires us to strategically segment resources by critical urgency to preserve human life while maintaining systemic stability. Ramesh's immediate next step is the implementation. He must submit the specific triage logic in writing to his senior management. Documenting the exact legal grounds of Article 21 and the ethical basis of the rule of rescue creates a transparent administrative record. It clarifies the decision-making process and shields him from internal political backlash. But executing a successful triage under pressure is still just applying a bandage to a deeply broken system. The underlying macro issue here is governed by the principle of occupational justice. Employers possess a unique, elevated moral responsibility to treat illnesses that are caused directly by the hazardous environments they created for their own profit. Efficiently managing an immediate crisis provides the necessary evidence to design the broader institutional systems that prevent the next one. The case demands 3 specific institutional reforms. First, establish a mandatory occupational health fund divorced from the standard pension pool. Second, a priority-based triage mechanism must replace the arbitrary first-come, first-served model. Third, independent committees must audit fund allocation, bypassing executive visibility bias. The scale of the industries that civil servants regulate is massive, and the stakes attached to their paperwork are life and death. The final takeaway for the aspirant is that sensitive administration involves weighing the severity of human needs against the raw volume of stakeholders involved.